Your book, The Secret History of the War on Cancer, which is an incredible read about how leading scientists knew in the 1930s that radiation and chemicals and pesticides were harmful to our health, but because of money and industry power and things that happened in World War II, a lot that got buried, we're focusing on treatment rather than prevention. How would you compare this story to the story of cell phones and wireless radiation today?
Unfortunately, there are some very important parallels between what happened in the 1930s with respect to pesticides, radiation, chemicals, and tobacco. And that is the following. In the 1930s, as an example, in Argentina, there was a very important institute for the study of tobacco in the 1930s. And it got completely forgotten in the run-up to World War II. Also, there was no internet back then. So it was very hard to find and share information. People had to go actually talk to one another. What an amazing idea. We don't do that anymore. There are many advantages of the electronification of communication. There are, no question about it. But one of the disadvantages, though, is it's rather easy to ignore things. If it doesn't exist on the internet, maybe it's not considered to be real to many people. And so as a consequence, we face a situation where there is the capacity of the large search engines to overlook, shall we say, suppress science that is inconvenient. And we have a lot of inconvenient science here, a lot of inconvenient science showing that there are dangers from wireless radiation. The International Agency for Research on Cancer concluded in 2011, which is almost 10 years ago, that there was enough evidence at that time to say that cell phone radiation was a possible human carcinogen. Since then, a number of scientists associated with the International Agency for Research on Cancer, or scientists like Dr. James Lynn associated with the IEEE, the electrical engineer experts that give advice, have all said, wait a minute, we've got a lot more science now. This is a human carcinogen.
Is it accurate that insurance companies have refused to cover mobile operators for years now because of the risk being so high? Can you explain that in more detail?
Well, think about what insurance companies do. They're basically handicappers. They look at the risk and they decide, well, we're going to invest in this one because it's very low risk, and we're going to stay away from those. Well, since 1997, some of the participants in Lloyd's of London have refused to cover any health damages from electromagnetic fields since 1997. Most recently, Swiss Re issued a white paper in which they referred to 5G as potentially the next asbestos. They said literally, using a British term, it will be off the leash, meaning out of control. And for that reason, the large telecom companies are all self-insured. And with this multi-trillion-dollar industry, they can afford to be self-insured. There are lawsuits now that will ultimately be won by people who have suffered brain tumors, many of them dead, because of their cell phone use. And even though the industry will have to pay billions, it will not affect them at all.
You recently said that the safety standards for our phones today are based on tests that were developed 20 years ago, and that they were developed for military and medical uses for people who didn't speak too much, 6 minutes. Can you explain that in more detail?
The standard for testing cell phones today is based on, first, a rather large head of a fellow more than 6 feet tall, weighing well over 200 pounds, who spoke for 6 minutes and